Right. So with concussion prevention, um, uh, the short answer for most of those questions is it takes a village. It takes a gestalt to improve what has been done to make things better, but we can make things better. So, with regard to concussion prevention, talking to the coaches with regard to safer drills, and that is a two-way street. Um, Talking to strength coaches, which is still the coaches, but to do neck strengthening, and neck strengthening is a very good thing.
Mm.
What people need to understand, because sometimes when if you say neck strengthening, um, a lot of people think of big huge necks with huge chaps, and that's not what we're talking about. Uh, that type of strength isn't what we need. We believe in the concussion prevention world. We believe we need dynamic neck strengthening and neck control. And
Mm.
where we borrowed that from is actually the boxing world. Boxers are taught how to ride a punch. In other words, go with a hit and then recoil and come back, and not, take it, which actually makes things worse. And there are methods to do that, but it's a dynamic exercise to strengthen the neck, but a dynamic movement of the neck such that the neck can be used as a platform to protect the head and brain. Um, then we
Interesting.
improve.
Look, let me ask a follow-up question on that.
Sure.
For
Mhm.
someone that's, whether an athlete or not, that's already had a concussion, multiple concussions in the past, and they want to prevent further concussions, what are some things that you would suggest to them for neck strengthening?
Well, dynamic neck strengthening is the answer. So that could be
Hmm.
resistance bands, a little bit of flexibility. Range of motion is important because if you don't have range of motion, then you can't decelerate and recover. Um, there's this concept of rhythmic stabilization, which takes a little bit of skill set, but we have that skill set. Um, uh, Not isometric. So where the neck is moving through a range of motion, whether that's with a resistance band or appropriate weights. Um, there is a method called proprioceptive neuromuscular facilitation, which is kind of like a physical therapy method that uses another person's hands.
Gotcha. So
Uh,
patients could look up those phrases and
mhm.
find treatments or find exercises based in that family of exercise.
Yes. Mhm. The second phase in the prevention is the brain oriented phase. And the brain oriented phase includes brain training, reaction training, and vision training, focusing on peripheral vision. And then there's two phases of peripheral vision: improving peripheral vision, improving the speed of peripheral vision. And all of those have certain methodologies. And those aren't new techniques. To be really honest, they're techniques that are used by um, rehab specialist physiatrists post severe traumatic brain injury, post stroke, that take a person who's impaired and make them closer to normal. If you use some of those same methods on somebody who's normal, healthy athlete, you can actually make them better, and that improvement is contributing to preventing the injury. And for example, if you are an athlete and you're on a field, let's use a football example, and say I'm going to catch a ball. And so I'm looking at the ball, my hands are this way, my attention is this way, but in my periphery, I see something coming at me. Well, if I don't trust my peripheral vision, and if my peripheral vision isn't fast, and if my peripheral vision isn't processing well, I don't know if that's one of my teammates. Are they wearing the same color jersey, or somebody else? And then I will maybe need to take my eyes off the ball and look to see if I'm going to get hit, or go for the catch and get hit thinking maybe it was my teammate and it was an adversary. Um, if you have this type of training, the theory is that you're better able to avoid the hit because you're more aware of your surroundings.
I see. So the peripheral training, what would that look like? Right, because someone, right, that is on a professional team or is on a collegiate football team, those trainers will listen to this video and what you said and understand what that means for treatment for individuals. But what about just someone like me or Brittany that's just living a regular life at home? How could like, is there an at home version of that?
Sure, absolutely. You can either buy or make colored cards. So picture a sheet or a colored card, and it's got characters around it in different colors. So you cover one eye the way the method works, and you look at a fixation target in the center, and then without moving your eye, you try and capture and spot all of the different characters around you. And so you're training your peripheral vision plus your discipline, and then the sheets can be designed such that the faster you capture all of them, the better your peripheral vision. One of your questions coming up is with regard to the Dynavision light board. There's a whole program on that. That's obviously a little bit more expensive. The other one that I have people do are flashcards. I mean, literally Uno cards and playing cards. And you can sit, say, across from your wife, Brittany, and then have a deck of cards and flash a card in her peripheral vision. And she has to know it while she's looking at you. And you don't necessarily hold it up there. In the beginning, you might, but you might just flash and go away. And then what did she get in that short period of time? You can do that at home.
But generally, it's just using your peripheral vision, like functionally, purposefully using your peripheral vision, and just doing things that make it harder and harder, like you said, holding it up and letting it stay there versus holding it up and taking it away quickly.
Yes.
Wow. See, these are the kinds of things that are so important that we get out to the masses of individuals that have had brain injuries, because in order to understand that, you need to talk with Dr. Joseph Clark or someone that has that same experience level, even to get that understanding. This is the first time I've understood the concept of like why the Dynavision board treatment would work so well for this, and other things that could work in place of that, and why that would make an impact on any sort of concussion prevention or recovery. Like, just putting all the pieces together is too complicated, I think, for most people outside of doctors in the brain injury space.
Right. But there are a lot of us trying to codify it and simplify it to be more accessible to, let's say, athletic trainers. So literally this past weekend, 1 week ago today, for the next 3 days, I gave a symposium with help, of course. I participated in a symposium that did just that, focusing, targeting people like athletic trainers, chiropractors, physical therapists who were interested in treating traumatic brain injury. And in that case, because you can't do everything, not in 3 days, but we were focusing on sports-related traumatic brain injury with vision training as part of the rehab modality. The last is educating the people, the athletes, the parents, the patients, that you need to trust the medical staff. We're not here to ruin your life. We're here to help people get better. And if you're able to communicate with us what's happening to you, and I say it that way because sometimes people don't realize that they've been injured. They might think it was a big hit, I'm okay, and not realize something's wrong. But if they're able to recognize something's wrong, the better they can communicate with us, and the sooner they communicate with us, the better we can help them. So, and that's an educational component.